Implementing a new payment technology can be very tricky. It's not always clear how patients will react being asked to give a payment either before the visit or afterwards through reminders. Plus, there's always the impact on administrative staff. It's unknown whether it actually will improve things or whether it will actually just make things more complex. Luckily, we're going to be talking to someone who's implemented a new technology in a very, very fast time, and it has had a positive impact on both. Hello and welcome to Healthcare IT Today, where we explore the latest trends and interesting stories from the world of health IT. I'm Colin Hung, and I'm here at the ECW Enterprise Summit, where I'm about to sit down with Kim Stahl, who's a practice administrator at Maryland Endocrine. She's going to talk to us about their journey with eClinicalWorks and how they implemented the Helo payment processing application and how it has improved their practice's bottom line and the patient experience. Let's get to it. Kim, welcome to the program.
Thank you.
I'm excited. Now, before we dive into some of the questions I want to ask you, can you give our audience just a quick overview of you, your role, and your organization?
Sure. So, Kimberly Stahl, I'm with Maryland Endocrine. We're actually a large private endocrinology practice, and currently we have 11 providers, but we're actually moving offices. We're trying to grow our practice, and so we're having a surgeon from Hopkins. Actually, he's trying to go on his own, so he's going to sublease and he's going to actually help out with some of our patients and surgeries. We see a lot of patients from. We don't see any pediatrics, obviously, 18 to 100 or more. So yeah, we're very busy. I've never worked with private practice before, so this was a new challenge for me. Just started in July. So
well, congratulations on joining the private practice side of the house. And how long has the organization been using eClinicalWorks?
So we're number 34.
Number 34,
so
wow.
We were since 2004, I've been told. And when I came, though, what happened was the former administrator, I guess, was not very tech savvy, perhaps, maybe. Not quite sure what happened, but there were no updates with eClinical at all. So it was very buggy. The doctors actually were of the understanding that eClinicalWorks couldn't do certain things. So I figured that was not true. Even though I had never worked with eClinicalWorks, I heard a lot about eClinicalWorks. So I was like, I think it's a really great EMR. So somehow, I can't even remember how I got in touch with Cyril Thomas. I don't know, but he's awesome. He's been so supportive and help. I mean, he really facilitated a lot of this happening, helped me out. So got in touch with him. He was like, oh, I've been trying to get into that practice forever. So he was very excited too. So I said to the doctors, I said, can you give me a month to try to figure out, you know, what's going on here and give you maybe a presentation on what I've learned. And so we did have a meeting when I first started with a different EMR company, but they said, okay, we're going to give you that time. And then within that time, I came up with a PowerPoint, showed it to them, and they're like, okay, all right, we're going to give you 6 more months. So fast forward, we've gone from being on the EXE version, very outdated, to now we're on the cloud-based version and the latest of version 12. So we moved pretty fast through all of that, but
amazing. It sounds like you really modernized the practice through the proper implementation of all that eClinicalWorks can do.
Yeah, we went through the RCM optimization, the BA optimization. We're going through another phase of the RCM optimization because I don't think that any of us, including me, knew just how manual everything was. We didn't really have anything set up for billing. They were doing everything paper, if you can believe that or not. So our AR, very, very large. And it just wasn't, you know, we needed to get set up with all of the optimization, to make it easier for the billers.
And I want to ask you about that because you were mentioning before that you've really done a lot of work with Helo Pay. So can you tell us a little bit about how you've deployed that?
Well, so we have the Helo Pay. We have we just set up the kiosks in, I think, January. We had actually a staff from Helo come who was wonderful. Meridol, we call him M. I don't really know how to pronounce his name, but he was awesome. He helped greatly to kind of give the office a better understanding too of the process. And he was there for the go live for the patients because a lot of our patients were not used to any of this. So this was all new to them. but it actually has really changed the workflow of the front desk. It's minimized the amount of staff that we need at the front desk, and the patient payments have really, really increased
Okay.
Since we've started this. So the patients were used to really not paying copays a lot of the time. Oh, I'll just bill that, or the front wasn't asking, and then they might get a bill or they might not get a bill for years. There was no consistency. So now they're getting their text, their call, and they're paying their bills. It's gone up. I've seen it increase probably by about $20,000 each month so far. So for April, we were at over $100,000 for patient payments, which has increased a lot.
All by simply just sort of asking for payment, maybe
Yeah.
when they check in at the start.
Yeah.
Also, it sounds like you're making use of the reminders,
Yeah.
so that people can pay afterwards.
Yeah, and a lot of them are actually. So a lot of the staff was like, "Oh, our patients are older; they're not going to use it." But we've actually found that that's our biggest demographic right now. Are the older patients. They want to pay their bills. They just maybe didn't know they even had a bill. So, and the Helo statements, I feel like, are so much more user friendly. They explain things better. We used to have a lot of patients calling, I don't understand this, or I don't understand that. And I think it breaks it down really so they can, understand it easily. We don't have as many calls for questions.
So
about
not
that.
only are you getting paid a lot faster, you're also fielding a lot fewer
Right.
calls, because it's the statements are so much
And
simpler.
we're saving a lot of money in postage, because our billers, when they did send out bills, they were printing it all out. I mean, sending stacks, thousands of dollars were going. I mean, it was a lot. They were sending out postcards that cost $1 a piece. It was just ridiculousness. So now it's saved us in a lot of areas.
And it sounds like the patients have reacted really positively to this.
They
They weren't sort of offended that you were asking for payments.
No, they actually, a lot of them were like, we just never got one. We didn't know what happened, or if they didn't know, then they just didn't ask, I guess. But so now I think the expectation when they walk in the door now is that they know that they're going to have to pay their copay at the time of service. They know they're going to probably get a bill, or they can pay it. They can click that text button, and pay it that way, or they can, there's a multiple amount of ways. Some patients still call, but that's okay. At least they're paying their bill. So
Right.
yeah.
So what's next for your practice? What are you excited to maybe implement
So
next?
we just started the Helo the No Show, and I really want to get more into that, and was trying to figure out how we were going to work that with the front desk and who we were going to sign for that. And originally, I didn't know about the Helo chatbot, but I've actually started trying to set up and customize ours, because I actually think it will help our call center. Because we do have those patients that call for the routine same thing all the time. So we can, set up those questions and answers with AI immediately. And then I do think, instead of waiting on hold, patients, they've embraced all the other changes. Why not embrace the chat back and forth? So I do think it'll help. And we talked to the call center. I'm like, okay, I'm just going to appoint one person to start with, and then maybe it'll grow, and we'll have a couple different people. So
yeah, well, we've certainly heard and seen some of the results that can be achieved with the predictive analytics around no-shows,
Right.
and it's just phenomenal in terms
Right.
of the show rates that
Yeah.
People have been able to achieve. So excited for you to kind of see that in your
and
practice.
it's really important too, because our practice, our docs have admin day right now, which I hope it's going to cut down a little bit with the Suno. But so when they have a day of 3 or 4 no-shows, it really does impact revenue. It really does. So.
And not to mention also access, right? I'm sure there's lots of other patients that they could have seen, or that were on a waiting list that couldn't come in at that last minute. So just being able to smooth that all out, just make sure that the patients that need to be seen can get seen.
There's also, so we had visited open access, and then we had decided that we weren't going to do it because our doctors don't share patients at all. So we didn't want patients to say, oh, I could see Dr. So-and-so sooner. But now I'm revisiting just them being able to request, because they know that they're not supposed to see another doctor. So 9 times out of 10, they're going to look for their own doctor's appointments. And I think that, along with the chatbot, will help the call center a lot. The only thing is that the former operations manager was the one who put all the schedules in, and they're not in correctly. So I have to go in and correct them before it'll work correctly. So
Gotcha.
that's next on my agenda.
I'm sure your patients are going to look forward to that.
Yeah, they're already all asking about it because we did open up one of the docs, and so now a couple of them are like, well, why can't we do that? You know, so I think that they're going to like that.
FOMO is real, and it's a great motivator.
Yes,
right?
definitely.
As you look back, Kim, across the journey that you've been on so far, what lesson are you going to take forward with you? What's sort of been a positive outcome that you're going to say, hey, look at that, and now let's go do this?
Well, I think that in such a short period of time, we've made huge changes. And I thought that, you know, there were points where I was like, there's no way, this is not going to happen. We can't get through all this. It's too much. But I really believe that if I hadn't had the support of, I'm going to call out some people right now because I have to. So Jody Farrell from the RCM has been a godsend. She will, I mean, her and I sometimes will talk at 10 o'clock at night because that's the only time that I had open, or, you know, I reached out with a question and she couldn't get back to me, and she will, she'll meet with my staff one-on-one, like she'll do video calls, whatever, to really try and help and assist us. And she's really been a great support. Cyril, Kunal have been awesome as well. It's just been a great experience. And every time I've had a question that I couldn't get answered by my.eClinicalWorks.com, which I am on every day, a million, trillion, bazillion times. I'm not kidding. I gave all the staff, they didn't have access to it, none of them. So now I'm like, guys, stop asking me. Go ahead and put in your own thing. Use the chat. And I said, lots of times if you go ahead and ask the question, it'll give you the scenarios and it works. And you don't even have to talk to anyone. So, I mean, I'm on there all the time. So I think there's just so many resources to help you whenever I have had a hurdle or someone hasn't been able to help. I have my contact people that I can reach out to, and they'll get me the help I need. So I've never felt like I was like alone, just doing this, you know, on my own. So I think that, you know, if you want to make the change and you know it needs to happen, you know, you don't even have to like kind of baby step it. You can just sometimes change, even though it's a lot at once, it's easier than kind of taking it, you know.
Slowly.
Yeah.
I like it. You've just shown that you can go all in and be successful at it. So congratulations on that. Kim, what's the website that people can go to learn more about your practice?
www.MarylandEndocrine.com.
Awesome. Yeah. Kim, thank you so much for coming on the program today and sharing everything that you did.
Thank you.
Really appreciate it.
Thank you.
Hey, I want to thank Kim for coming on camera with me and telling us about the journey that she was on with Maryland Endocrine and the implementation of that new payment method with the help of eClinicalWorks. It's very clear that the new technology has really made a big difference to their bottom line. And hey, if you enjoyed this interview as much as I did, please like and subscribe. Also, head on over to healthcareittoday.com where you can find more great content like this. I'm Colin Hung. Thanks for being here, and I'll catch you on the next video.